Hello, everybody. I'm going to wait a minute and see if I can get some people on here. There's about a 20-second delay as far as getting on. Yep, I'm on there. So if you want to come on and say hi, that'd be great. Gonna start teaching here in a minute. I'm all excited about these Facebook Lives. Y'all have been enjoying them. You've been telling me how well they're helping you, and I really appreciate that. So while I'm waiting for you all to jump on here, I'm going to go ahead and bring up the presentation. Okay. Really glad to see you all. Okay, so let's get started. I'll try to keep an eye out for people that talk to me while I'm going through the presentation. Today's presentation is on pneumothorax. I find that there are a lot of people in my office and online that are having trouble with this concept. Hi, Crystal. So what is a pneumothorax is the first question. Pneumothorax is when air enters the pleural space. Hi, Bree. And it causes a collapsed lung. So now there are 3 different types. There's a closed pneumothorax, an open pneumothorax, and then the tension pneumothorax. So the closed pneumothorax happens when there's a rupture of a pulmonary blebe or sac deep in the lung space, and air gets into the pleural space here and it causes the lung to collapse. An open pneumothorax is from when we have had a chest injury and there's an actual hole into the chest, or we've gone in and done surgery, and that will put air into that pleural space. And then the last one is a tension pneumothorax, which kind of comes from the open. I have an open area and the air is being pulled in from outside, and it literally does collapse the lungs just like it did previously, but it pushes on the trachea up here and it moves it over and it pushes it to the unaffected side. And the problem there is it affects the heart's ability to function. This is very life-threatening. We need to get a hold of the doctor. So signs and symptoms of pneumothorax. We have absent or marked decrease in breath sounds on the affected side. They can be cyanotic. They have decreased chest expansion unilaterally. So on one side, the chest isn't expanding like it should. We have dyspnea. We have hypotension. They can complain of sharp chest pain. They have subcutaneous emphysema, which is where the air that was in the lung is now escaping out into the skin. And it's like a bubble pack on the skin. If you rub your fingers over, it'll pop just like bubble pack. And we all are kind of addicted to that, or some of us are. I'm admitting it. I'm addicted. If I see bubble pack, I pop it. I'm sorry. So subcutaneous emphysema would be similar to that. They're also tachycardic, tachypenic. Now, there are other symptoms that you can see, and they're from the other 2 kinds. That sucking sound would occur with that open chest wound that I was talking about, and the tracheal deviation to the unaffected side, that would occur with the tension pneumothorax. Again, you would call the doctor because that is life-threatening. So next is treatment. So diagnosis is done by a chest x-ray. We put O2 on them as prescribed, and we place them in Fowler's position. Now, and I was putting this in, and I need to say that if they are really having trouble breathing, I hope you all know that you would raise the bed into high Fowler's. You should anticipate the doc is going to put a chest tube in, and usually if they're in the hospital and this happens and they're in their room and the doc comes in, we're doing it in the room. We're not taking them to OR to do it. So anticipate that you're going to be helping put a chest tube in, and then after that is in, to monitor the chest tube drainage. So I'm going to talk specifically about an open wound, the open pneumothorax. The treatment for it is to cover that wound with a non-porous dressing. And again, they're probably going to have a chest tube, but this is in addition to that. And then last is the tension pneumothorax. If we think that is happening, if we can see the trachea is deviating and heart is having harder time doing what it needs to do, pumping that blood, which is what the issue is going to be because the trachea is going to be pushing on it, then we need to contact that physician immediately because it is life-threatening. So these teaching sessions that I've been doing are all sponsored by the company One NCLEX Tutoring. And we hope that they're helping you with topics that you're having trouble with. And again, I suggest that if there's a topic that you would like to have taught at one of these sessions, please let me know in the comments below or message me on Facebook, or you can email me. And I will see you next week at 11:30 Eastern Daylight Savings Time. Have a good day. Bye-bye.